Hi, students. I just finished grading all your pediatric conditions, blog posts, and quizzes for um, this week's module. So, besides the individual feedback and comments, which most of you got a lot, I spent in a good way, not in a bad way. I just try to be really thoughtful and provide a lot of feedback, especially in these early modules so that you kind of know what the expectation is and I can help guide you more. And then typically the expectation gets raised with each module, especially as I'm giving more and more guidance and feedback. And my feedback might get a little less. I usually still have significant amount, but the expectation is definitely raised. There were also some general comments that I wanted to make sure I gave to everyone. So like I did last module, or I have in the past, sometimes I'll do that as like a written announcement with just some points I want to share. And sometimes I'll do it in a video, in a screencast like this. And some modules won't have general feedback, but usually there's some things I want to make sure that everyone is learning. So please forgive, it is 1:30 in the morning. I just finished doing grading, so please forgive the t-shirt attire. I'm wearing my good old MedFlight t-shirt and the hair, and I'm sitting in my living room. So, but when you do webcams or other videos or whatever, please don't feel like you have to be dressed up or in classroom appearance. You can definitely be sitting on your couch in your t-shirt with your messy hair like I am. So I look at the learning, not at the outside appearance. As long as we can see you, I guess check, make sure it's not too dark or things like that. But don't worry about anything else. Just worry about your learning and the content. So a few things I want to cover and clarify is one thing is coping kits. So in Katie Reese's lecture, she talked about coping kits in a way that it's like a resource folder, a resource packet, or new diagnosis kind of packet with resources. And in some hospitals and child life programs, that's what a coping kit is called. In some hospitals and child life programs, that is actually called a resource folder or a new diagnosis binder, or like at our hospital, new oncology diagnoses get like a whole bag full of resources and like water bottle because they're supposed to increase their fluid intake and things like that. And partly that's funded by the hospital and partly that's funded by Badger Care Cancer Network, Candlelighters, which is the national organization that we have a chapter, and Catherine, who is our resource assistant in the child life program, does that. And in some programs, that's the child life specialist that's kind of giving that initial resource packet, new diagnosis education. In some hospitals, it's the social worker. In some departments, it's the nurse practitioner, or some do parts, so it varies. But I wanted to make sure you understood that that is one version of what's called a coping kit. Another version, if you go to another hospital or another child life program, or even in another department within our hospital, and someone says, can you grab me the coping kit, or I'm going to use the coping kit with that child, they're actually referring more to like a procedural support distraction tool box or bag or kit. And then again, in some hospitals or in some departments, including in our hospital on the inpatient unit, that our pain committee as a whole helped to develop, and our pain committee is multidisciplinary as a hospital with child life and nurse practitioner and health psychology and things. New admissions to the hospital, the admitting kind of primary nurse is supposed to introduce either a coping kit that's a little bag full of things, or offer them a menu of choices and let the patient and family pick what coping items they would like to have. And that kind of varies by unit and department and nurse, and I think it's kind of ebbed and flowed over the years at our hospital. But what that coping kit is different tools that the child can use to help, not just with procedural distraction and support, but with like when they're in pain, when they're anxious, when they're stressed. So that could have things depending on the age of the child. Some of the things we have in the coping kits at UW at American Family is like stress balls, bubbles, pinwheels, magic wands, I spy books, Sudoku books, mandala, adult coloring for the teens, things like that. So sometimes a coping kit can mean what you have to use with stress, anxiety, um, pain, not just procedural support and distraction. And sometimes it means the resources that Katie Reese talked about. So all your answers were correct because that was what Katie Reese put in the lecture. I just wanted you to kind of be aware that in the world of child life and in the world of children's hospitals and pediatric chronic care, coping kits can mean different things depending on what department or hospital or child life program you're in. So just make sure if you're having a conversation with someone, that whether that be another child life specialist or a nurse or nurse practitioner or social work, that you're both on the same page when you say coping kit of what you mean, so there's not misunderstandings and there's no right or wrong. So wanted to clarify that. The other thing I wanted to clarify was kind of what we call central lines, and names of them and things like that. So there are actually a lot of different central lines and types and names that like we use in trauma and the ER that weren't introduced, that Katie didn't talk about because she was talking specifically about leukemia. And I'm not going to even go there for you, right? I'm just going to focus on what is typically used in kids with an oncology diagnosis and their treatment, okay? But there's still some different names depending, again, on what hospital you are or what department or what resource. Sometimes it's kind of like saying Tylenol and acetaminophen or tissue and Kleenex, where sometimes some people or departments or hospitals will use the brand name, some will use the generic, so it means the same thing. Sometimes it's, just the preference. There's a couple names for things and is the preference of the hospital. So oftentimes a certain hospital or a certain department will kind of use the same name, or often you'll find that staff like nurses, physicians, child life specialists, wherever they first trained, wherever they first learned that name, like their first practicum or their first internship or whatever for us, and for the nurses where they first trained or worked, same with physicians, whatever name they first learned it is kind of what they often will use. I mean, I do that with the little, maybe some of you have seen them or not seen them. If you haven't, you will definitely in your internships in the hospital. The little, like, not going to the pharmacy to the actual person window, but the little, like, med station thing where the drawers pop out that the nurses can get commonly used meds and they have to scan. Some hospitals call it a Pyxis and some hospitals call it an AccuDose. And those are two just different brand names of this, like, pharmacy dispensing piece of equipment of what it's called. And often, or sometimes, the name people call it is not actually the name of what the actual brand is. And in that hospital, it's just maybe the culture of that's what everybody calls it on the unit, or that's what that particular person called it. So that's just things you learn. Like, do you say pop or soda? Do you say creek or crick? Do you say ibuprofen or Tylenol? Or ibuprofen or Advil or acetaminophen or Tylenol, excuse me. That kind of thing. So what I want to clarify is there's regular IVs, right, which we often call PIVs, peripherally inserted, or peripheral, sorry, it's 1:30 in the morning, peripheral intravenous catheter, or PIV. The P means peripheral, so it means you're inserting it through the skin. It doesn't require like a surgical opening, like a cut in the skin. It's a poke through the skin, okay? So that's what the P, the same as a P in a PICC line is a central catheter, but it's a peripherally inserted central catheter. So PIV is an IV. It's what you all know as IVs, hopefully. The little straw in your vein, in your hand, arm, foot, can be in scalp, whatever. So that's what an IV is. This is the American Cancer Society website. It's www.cancer.org. This is their treatment and support section. It's actually called central venous catheters, but I'm kind of scrolling down. This is information for adults, so it's written in adult language, so not necessarily how you would explain it to the kids, but it gives you as an adult a good understanding. So then there's central lines or central venous catheters, or CVCs is what most people talk about. So there's the ports, which Katie Reese talked about. So again, it requires a cut in the skin. So it requires going to the operating room. Most kids get general anesthesia for it or get sedated for it. Older teens or adults, if they can cope, you can do like a regional block with lidocaine and be awake for it. But that's not something that commonly happens with Peds patients. And that is the little button port that Katie talked about. So some people call that the port. There's also some brand names: Portacath, Bardport, Passport, Mediport, Infusiport, Powerport is a type of port versus a non-power port. So different places will call different things. Also, kids will give them names. It's my tubie, it's my button, it's my whatever. So you'll get the kids, just like kids give different names to their body parts and things. So that'll happen too. So I want to clarify that. Then a PICC line, typically in the arm, can be in different places, but typically in the arm. And is that it's a central line, but it's peripherally inserted. So typically at most hospitals, it's done one of two places. It's either done at the bedside, which is the most often place it's done in or one of the more often places in our hospital, or it can be done at the bedside in a sedation clinic, like in our first floor sedation clinic if kids need sedation, or it can be done in interventional radiology, and which is less often where it's done in our hospital or at American Family, but in some hospitals that's like the standard of where they do it, so it just depends. But whether it's done in interventional radiology, they're using a fluoroscope to see what they're doing, obviously in ultrasound. Even if it's done at bedside, the standard practice nowadays is to use an ultrasound to help. There are some nurses that are still, or nurse practitioners that are still trained to do it blind, and every once in a while you'll see that, but it's becoming more standard practice and best practice to use an ultrasound. So like at American Family in the PICU, the nurse practitioners are the ones that train to do it on the PICU patients. So Sarah Sentius and Lynn Sears are two NPs in our PICU. And in other units, they typically call our VAT team. So our VAT team in most hospitals, most children's hospitals have a VAT team, or people call it an IV team, is Venous Access Team, it stands for. And in some hospitals, they just do peripheral IVs, but in our hospitals, there's kind of two arms of the VET team, and there's people that go around and just help with difficult peripheral IVs, and our VET team uses an ultrasound most commonly for that too. And then there's teams, members of the VET team in our hospital that can do bedside insertions of a PICC line, and they always use an ultrasound for that. And there's some nurses that can do both on that team too, but those are kind of the two arms. And obviously Child Life is super involved in preparation and support during those, whether it's in bedside, on a unit, whether it's in the PICU if the kid is awake, not intubated and sedated, or in sedation clinic. We're often, if that gets called to do a line, the VAT team here we have a great relationship with and have developed a great system, and they pretty much 99.9% of the time, if they get a consult for it and they don't see a note from us about assessment on the PICC line and preparation, they will page us before they acknowledge the consult or let the doc know they agree, and have us assess the child and family to see whether we think it is appropriate for the VAT team to do it at bedside in the room, or whether we think the child should be scheduled for a sedation clinic. So we've developed over the years a really good system with them, and they're very great about that. So yeah, the PICC line looks like that. It typically has a double lumen. These are called lumens. Kids call them pigtails or they're 2Bs or whatever, but they're typically called lumens. So double lumen means there's two lumens. And then there's other types of more tunnel, what we call tunnel central venous catheters, or catheters. Typically in kids, they don't do midline catheters. Not typically, not in leukemia treatment. So what I wanted to show you was Katie Reese, because where she did leukemia treatment, where she trained and worked, it's called a Broviac. At a lot of hospitals, they will also say Hickman. It's the same thing. It's that central line that typically hangs from the chest, typically a double lumen for the purposes of leukemia treatment or oncology treatment, transplant treatment. I've seen it called Neostar at a few hospitals. I've never heard of it in my career called the Grosh-Ong, but maybe somewhere. But Hickman and Broviac are the two most common. What you'll hear when you're doing internships and volunteering at American Family is most of our staff, both Child Life and nursing, call them Hickmans or central lines. There's a few, Katie Reese and a few others that call them Broviacs because that's where they trained, but most of them call them Hickmans. But again, you'll go other places where they call it something Broviac exclusively. So, and then like I said, there's other central lines. You can do like jugular central lines in the neck, arterial in the groin, things that we do more in like trauma situations or maybe in the PICU when you're coding a patient or they're kind of on the edge of your fluid resuscitating them or they're really, really sick. That's more in an acute setting and not utilized typically for like long-term treatment, especially in the HEMOC families for various different reasons that you don't need to understand. So for leukemia oncology treatment, this, a peripheral IV, a PICC line, a central line, which could be a portacath, or a central line hanging from the chest, which could be a Hickman or a Broviac, are the ones I kind of wanted you to understand and know that there's some different names out there. So that's what I wanted you to understand for that. And then lastly, I just wanted to share, I'm going to make that big so you don't need to see that anymore, that as you learn more about psychosocial goals, psychosocial terminology, therapeutic goals, therapeutic terminology, terminology and phrases that we use in child life specifically and child development and psychosocial care of kids, and you're learning these through your readings for pediatric conditions, which you're supposed to be working on your pace, right? And listening to the lectures in pediatric conditions and listening to the terms and phrases that these various child life specialists that have given of their time and expertise to teach you are sharing with you. And then also you're learning these in your psychosocial course too, right? Both your in-class discussions, your readings, your assignments, Katie's lectures and feedback to you. So my expectation is that when in both your blog posts and your quizzes and your other assignments for pediatric conditions, there is a question requesting you to discuss or explain a psychosocial goal or a therapeutic, the therapeutic value of an intervention or a psychosocial implication. My expectation is that you will continue to use more and more and more terminology that is more appropriate or what the professionals in the world of child life and psychosocial care and child development use. So for lack of a better word, more child lifey terms and phrases and language. So that is my expectation. So be mindful of that, be paying attention to that. And it's fine if you write a term and then want to explain it more. That definitely would be helpful to make sure that you are understanding it correctly. And what I mean by that, one example is maybe instead of saying, I'm doing this intervention or this intervention, the therapeutic value, psychosocial goal could be, to make the patient be able to make more choices and have them make more decisions and, really let them pick what color they want and let them, that goal is to enhance their control and mastery, right? So phrases like enhancing control and mastery, promoting normalization and socialization, reducing anxiety and distress, things like that are more of the terms, and there's many more. I'm giving you a few examples that I want you to start developing the language of a child life professional because that will help you in your practicums, internships, and future careers. Not only help you communicate with other child life specialists more succinctly and accurately and other psychosocial professionals and other professionals on the medical team, but also make you sound and speak and write like the educated professional that you are, an expert. So, all right. I hope all that feedback is helpful as you move ahead. Continue to look back on these announcements and these, general feedback posts as you're doing your future modules, your quizzes, your condition overview blog posts, your assignments to make sure that you are following this feedback that I'm giving. Because once I give a feedback either group-wise or individually to you or guidance, my expectation is that you will then incorporate and implement that feedback in all your future posts and assignments and projects and all that. So Have a great night. Everybody's doing a great job so far. You guys are doing really well. You're right where we should be. I have no major concerns or worries right now about anyone or anything. Different people are at different levels, but everybody is within the range of where I expect you to be at this point in the course and in your semester. So yeah, good job. I just want to share that. So no one should be totally stressing out. And if you are and you have questions about things you're not understanding, future assignments or projects, you want more details or clarification, that is why I'm here. Please email. If it's a quick question or a simple one, we can converse through email. Like always, I'm happy to set up a time for you to meet in the office or via WebEx, or even if it's something that we can talk through. I have actually met with a few people just over a phone conversation if it's a quicker one, and sometimes that's easier too. So, variety of options, and I'm here for you. Please reach out when you need it. Have a great night.